We're very lucky tonight to have Ivan Miller, who's the Executive Director of ColoradoCare Yes, or the Colorado Cooperative Campaign. They kind of mingle together in my mind. I'm not sure if they're separate or not. But Ivan is a clinical psychologist living in Boulder, Colorado, who's been very active in healthcare reform probably a few decades.
Thank you very much for having me. I really enjoy meeting with like-minded groups from other states and seeing the kind of movement that's taking place across our country. I've been involved in healthcare reform for a couple of decades and been involved in writing healthcare designs for healthcare systems and healthcare economics. And so I've been the main policy and economics person. I was the health policy advisor for Senator Aguilar, who's the physician senator who's leading this campaign. I thought I'd start off with, I'll give you a brief history, a description of where we're at in the campaign, and leave most of the time open for questions. So I'm aiming that by 9 o'clock my time, which I think is 8 o'clock your time, it'll be time for questions. Our efforts to get universal health care in Colorado officially started 8 years ago when we had the first legislation introduced in the legislature. We've had, since Senator Aguilar has been there, it's been through the Legislative Council 3 times. So we've had the wonderful benefit of having all the lawyers in Legislative Council look at it a number of times to make sure that it's actually a system that will work. And they did the analysis of the revenue collection, so we're sure there will be enough money. Interestingly, we started out as a Healthcare for All Colorado, which was a subdivision of Colorado's PNHP, and we couldn't find anybody to sponsor legislation. And at that time, Senator Aguilar was president of HCAC, Healthcare for All Colorado, and it was actually at a national PNHP meeting. Somebody came up to her and said, you know, the representative in division, or the senator in Division 36 just resigned. Maybe we could get somebody appointed that could run our legislation. And she lit up like a light bulb and said, well, that's my Senate district. And about 6 weeks later, she got herself appointed to the Senate for the purpose of introducing universal health care. Our proposal, in the legislature, and it shouldn't surprise you too much, we were able to get a lot of Democratic support until it got close to passing, and then it gets killed by the leadership. This is a phenomena that Bernie's seen, and it pervades our campaign, that the national establishment is incredibly frightened of taking on single-payer health care. So we got to run it through the legislature, got to build up a base and design a really good system. Our system overcomes the problems they had in Vermont. One of the advantages of the way we did is we had a lot of trouble getting allies because nobody believed we could do it, and nobody believed we'd ever be on the ballot. So we got to write it in a way that would work without having to give away favors to every ally that comes along. My colleagues in Vermont, in the governor's office, said they would go around and try and negotiate taxes with people, and every group they went to said the only good tax is a tax on somebody else. And part of actually what killed the Vermont group was they had the principle right, but when they ran it through the legislature and the political process, every group they went to, rich people, poor people, old people, self-employed people, you name it, said we want a break. And they gave a break to everybody, and the middle class ended up with this tax that nobody could afford. So I guess the lesson I'm trying to convey for your efforts is that it's important to come up with a system that works and to beware of the political process. We have a 10% flat tax. It's split between employers and employees. It's modeled after Medicare. We started out calling it universal health care because we had so much trouble with the word single payer. People had made up their mind and they wouldn't talk to us. They were opposed or for it, or they decided it was impossible. It turns out when we did our polling, both universal health care and single payer polled not that well. When we said Medicare for all, the polling jumped enormously. In fact, it jumped so much higher above universal health care that our pollster thought it could be a mistake and had to consult with someone else because he'd never seen such a change caused by language. Apparently what our analysis was that people couldn't understand what universal health care is. They couldn't visualize it. And single payer, there is so many phony arguments to get people distracted. But Medicare for all, they both could understand what it was and they liked it. It's enormously popular. Now we have to, when we work with physicians, we have to explain it's not Medicare because Medicare underpays providers. But our public message is that it's Medicare for all, and it's as close to single payer as anyone can get on a state basis. It covers everyone. It wraps around the federal programs like Medicare. It provides supplemental benefits in the VA, and it includes the undocumented. We are not allowed as a state to eliminate the insurance industry, but ColoradoCare eliminates the market for the insurance industry. And so effectively it does away with insurance. The benefits are extremely comprehensive. Some of them come because in getting the Medicaid waiver, we only have one class of resident, and residents are who are covered by ColoradoCare. So whether they're Medicaid eligible or not, we have to pay the same amount to providers for seeing residents. So Medicaid is wrapped in, and the big difference is that then ColoradoCare increases reimbursement for the Medicaid patients. But to get a Medicaid waiver, we have to promise that we will do everything Medicaid does, all the comprehensive benefits and programs. We also have to get the ACA waiver, we will have to promise to do everything that the ACA does, at least as well or better. So that the benefit level is forced very high, both by the amendment and by the waivers. The other advantage is as you know, when you get into a single system, it can eliminate administrative burden. We eliminate over $6 billion of unnecessary bureaucrats that are unnecessary bureaucracy and profits in the insurance industry. And in fact, it's curious. Our opposition says, "Oh, that'll put tens of thousands of people out of work if you eliminate the unnecessary administrators." It's a strange argument to say that we should keep the insurance industry so that unnecessary administrators can keep their jobs. So we try to turn that argument around on the opposition. In the end, the net savings for the state is 15% of healthcare costs, which is $4.5 billion. Now we also, build into this. There's a $1.5 billion surplus in case there's a mistake, and there's also another $1.1 billion that was allocated for dental services that isn't required. So there's a huge marked cushion there if in reality this turns out to be more difficult than we thought. But it is a system that's designed to work. It has a mini tax for 2 years to set it up, but the result of that mini tax will be a cash reserve of about $5 billion on the opening day. So it's really set up to have enough money to run like a good business. David said that we use a we're outside of government, and part of that is because Senator Aguilar has been so discouraged by what happens in politics. There are so many people who can stick some kind of monkey wrench or special favor or something in legislation, and the insurance industry has so many politicians frightened that we thought it was better to use the Constitution, put it outside of government in a cooperative business, which is a democratic business model, and then it can run its own elections. It's got a 21-member board. The first board is appointed 15-member board. Now, the opposition has said, you can't have this big, very expensive operation run by such a small board. Well, there's 3 dominant insurance companies in Colorado's future. They are 3 to 4 times bigger than ColoradoCare. They have 11-member boards. Their boards meet in private and behind secrecy, and their goal is to get profit. ColoradoCare has a 21-member or 15-member in the appointed board, has total transparency, and represents the interests of Coloradans, which are patients, providers, and employers. We think that it's much more trustworthy to have a transparent board hiring the CEO that's going to run it than it is to have the insurance industry 11-member board hiring it. Our opposition, it's curious. They call themselves Coloradans for Coloradans. That they were going to speak up for Coloradans. 99%, in fact 99.6% plus of their money comes from giant corporations, mostly out of the state, and mostly insurance companies. So we have nicknamed them corporations for corporations. And that really characterizes the campaign. We are a grassroots movement. We got 158,000 signatures to be on the ballot. We had 550 volunteer signature gatherers. We now have 2,500 volunteers. We're an organization of the real patients, providers, and small business people that want to break from the insurance industry. And 99% plus of our money comes from real people, not from corporations. So it's really the people against the corporations. And that's going to be a theme as we go down the road. United Healthcare is the biggest donor, having given $1 million to our opponents, and they're also raising their rates 28%. And that's just a great talking point. That how can this rich insurance company be putting all their money into killing ColoradoCare unless they're just protecting obscene profits and an obscene system. It's obscene because it kills people, and the people it doesn't kill, it demoralizes. So the campaign, I mentioned before with the poll, and we started out and found that it was much better to compare ourselves to Medicare than to try anything else. There was recently, within the last couple of weeks, an independent poll done by a conservative polling company, and our amendment starts out, and according to Colorado law, it has to lead with taxes, and so it says, "Shall taxes be raised $25 billion?" Which is not a great way to start a conversation, but they'd find out how much it cost anyway. So I'm fine with putting it up front. So then it goes on and describes it. The independent conservative polling company found that when people just read the language, 43% wanted to vote yes. 43% of people were willing to vote for a $25 billion tax increase. And our state budget is about half that, so it's really a huge increase. When people heard the arguments that we presented about why it's a good idea, it went up to 55%. When they heard arguments from both sides, we won 51 to 43%. That we have a winning proposal. That if we can get our message out, a lot of people run around saying, oh, how much money are they going to spend? And I don't know whether they're going to spend 10, 20, 30, 40, 50, 60 billion on an air war. It's not a matter of how much they spend. It's a matter of whether we do our campaign the way that we should do it. And our campaign has to be grassroots. It has to be door to door and social media. The people who are most reluctant for it are people who are in their 40s and 50s and in power positions in any part of the establishment and have good health care. People under 35 are the greatest supporters because they're looking at decades of healthcare insecurity. Young people really realize what a mess they have, and they don't have health insurance with their jobs, and they may have 2 or 3 jobs, and they may change jobs twice a year. So the whole youth is aware of the need to have some kind of government controlled health care. Seniors are for it. We have some exemptions for senior tax income, but the main thing, mostly seniors want it because they have children and grandchildren who don't have health care. Once you realize we're not talking about which kind of plan do you get next year for yourself, but this is a how much will it cost you, and remember that even if you're a 30-year-old disabled person, you have brothers and sisters and parents who need health insurance. So everybody has a family, and it ensures it assures that the whole family will have health care. To counter the tax issue, we keep saying do the math, and we have a calculator on our website. When businesses compare what they pay for health care with the tax, they see how good it is. The opposition does not want to talk about health care at all. They just want to say tax, 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 run for cover. The Latinos and single women are also are also really positively for this. And I can't say how often politicians and established foundations that are supposed to be for universal health care, how frightened they are of us. That an organization that's dedicated to universal health care and the incrementalism system, when we go in, they should be joyful that we figured it out. And they just get anxious and they look for tiny problems to give them an excuse for not taking a position on this. And if you look at their board of directors, they've got the who's who of people who made a fortune off the current insurance industry system. And we refer to the current system as the insurance industry system. We're not replacing the current system. Our providers and healthcare in Colorado is excellent. It's the insurance industry that's failed. We have a tremendous regional infrastructure. We have great materials. We have lots of volunteers. That's the strength of our campaign. We have a winning message. Our weakness is in fundraising, that the large funders have not given money to us, and that's partially because the Colorado state leadership has put pressure on all large funders to not fund us. They're afraid to have us on the ballot. We say sometimes that we know Republicans always come out and vote. What are they afraid of? Are they afraid that some conservative Republican's going to vote twice if we put this on the ballot? But they are afraid. They think we're going to lose Colorado Senator and Hillary if this is on the ballot, because it'll be so unpopular. And in reality, it's the kind of thing that'll bring out the Bernie voters. We are reaching out to Bernie's staff and supporters in every way. In talking with Tom Reed and in different states, California, Washington, Oregon, I'm convinced that the first, second, and third states in the country to get universal health care are going to be the western states, and it's going to be Washington, Oregon, California, and Colorado. And California is, they're dead serious about this in 4 years, and we expect to get. We've been talking with Nurses United about help from them and their organizations, and we expect increasing help. We're in an alliance with them right now to get the Medicare for All and the Democratic National Committee platform. In fact, if any of you have not signed the petition for that, go to the National Nurses United website and sign the petition tonight. They want the petition finished by tomorrow. So we're working with the other national organizations pushing for Medicare for all, but I don't think anyone who's realistic thinks it's going to happen in the federal government first. It's got to happen in the states. What do we need? We need to expand our database of potential small donors. That's who we get, is small donors. We need support eventually later on in a campaign for phone banks, and that can be done out of state. The Healthcare Now is helping us. The organizations that are doing the Medicare for All petition will share the signers with us so that we can then reach out and say, we have professional digital people. The guy who worked with Howard Dean for 6 years at Democracy for America is leading our digital campaign, and he knows how to reach out to people who are potentially like us and say, you want to hear about ColoradoCare, and here's why it's important, here's how it affects you, and even though you're not in Colorado, and then ask for money, and that's how it's done. That's how Bernie did it. So I think I can't remember whether Washington has already written to all your members, and Washington PNHP, and said, please go to the website and sign up to follow ColoradoCare. What happens in Colorado will be a trendsetter. But if you haven't, I wish you would. We've talked with Oregon about that, and we're with the California people. They're very strong Bernie supporters, and they've thrown huge amounts behind Bernie, and they've said they want to help us, but they've been waiting till some of this stuff wrapped up with the California primary, and then Bernie today talking about the platform that's still going to be active. And then we have the People's Summit in Chicago this weekend, and after that, I think they'll be more involved. That's the kind of money we need. We need to reach out and have the national support if we're going to beat the insurance companies. The insurance companies, and we agree, everyone agrees, if Colorado goes for universal health care, a lot of states are going to follow. So the insurance companies are pouring in money to stop us, and it's a life and death struggle for them. We expect a pretty hard-hitting campaign. We expect to be able to discredit the insurance industry because nobody likes them, and that they are clearly the ones giving the opposition message. We also think that the value of TV is going down. Most people under 35 don't get and watch the news or watch that much TV. There's a big movement away from TV with young people, and with so much dirty money, because Colorado's a swing state, for the past 6 months, all the TV time has been sold out for the campaign. That all the money's been bought up by Citizens United money, all the TV time. Now it can be resold at a higher price, but it's going to be saturated when viewers see that nonstop dirty advertising. It'll decrease the amount they listen to it. And one other thing that I think is important to physicians is when we have gone to physicians in Colorado, that now that this is a reality, we're on the ballot, they kept saying, oh, well, this will never happen. There's a lot of them saying, oh my gosh, everybody's going to leave the state, and which is kind of silly. If you look at it, both proponents and opponents agree that it's the only way Colorado can work is to pay providers enough to attract them to Colorado. That that you can't pay providers too little to attract them to Colorado, because then it would fail. It's a business. It's just like you have to pay the water bill. You have to pay the provider bill. So it will pay providers adequately. On the physician, on our website, ColoradoCare.org, there's under supporters, there's a Physicians for Colorado Care page. I think you'd be interested in looking at it. And at the bottom of that page, there's 2 links for articles. One is Colorado Care and Providers, including reimbursements. And that's been very persuasive. The providers wanted us to tell them exactly how much they'd be paid in 2019 for every service. And that's our response to that request. So I think that's my overview, and I'd like to open it up to questions.
Okay, I've got 2 questions. At the single payer summit in Chicago, I think it was end of last October, Donna Smith put out a call for All Out for Colorado, basically asking for support from all single payer supporters across the country to come to Colorado to get a victory, like you said, as much of a single payer as you could get, but it would cover everybody in the state. So I was wondering, that's my first question, is do you plan to do that to get people from across the country to come to Colorado to help you? This would be with doorbelling and, sort of grassroots work. That's my first question.
Okay, well, first with Donna Smith, I mean, she's the best connector in the country. She brings people together. And we are asking for support all over the country. And I think it's been there's been a little problem because people think it's far off. It's not far off to me. I get a crisis a day, and we're campaigning all the time. We're getting interns and they're spontaneously coming before we've advertised. Young people who want to work on the campaign. And these are non-paid interns. We are going to ask people from all over the country to come. We're going to ask young people to come. That this is an exciting thing. But the combination is, even if you get an intern that doesn't cost any money, you still have to have that staff to integrate them, and raising the money for that staff infrastructure is a real challenge.
Second question is about PNHP National. From what I read through Don McCann and the response, supposedly you would ask PNHP National for support and money, and there was a response from Hemel Handler and Ida Hellender, and it was very negative about your program, and I was very disappointed with PNHP National. But if you could just say a word about what's your relationship with PNHP National, and what's your response to, in my interpretation, as their negative view of what you're trying to do.
I don't know how many of you know, have talked much with Ida or Steffi or David and Don. They're kind of perfectionists about our plan is the only way to do it, and that they are not going to approve somebody else's ideas. They really think it has to be national and it has to be exactly their way. Given that, though, that Tom Reed had a dinner with the 4 of them the night before the Chicago meeting, and they were very, very positive emotionally. The vibes were all very positive. And Don McCann afterwards went up to Tom and said, I've never seen David so excited about a state plan, that he thinks this is really good. They're not going to support a state plan that does not include, their plan has to be national, and that's what they're pushing for. So I think the response that they gave was as positive as they can get. They're the kind of people who say, well, it deviates from this and this and this from what we want for a national. you can't do any better on a state level. So I don't see them harming us in any way. In fact, I think they'll be supportive. They're not going to go. They are supportive, as a matter of fact, but they're not going gung ho. I mean, Don has asked people to donate to Colorado and support us, and he's speaking out for us, and so it's not a national plan; it's a state plan, and my theory is that's how we get to a national plan. After the first 3 states fall, I mean, you guys legalized marijuana too. Look what's happening around the country. One state after another falls. With Colorado, in Colorado, the marijuana initiative had just 2 or 3 small-time politicians supporting it. All the rest of the politicians were against it, just like they're against single payer. We even had a governor, a Democratic and Republican governor, do a radio spot saying we're Democrats and Republicans. And the one thing we can agree on is this marijuana initiative is bad for Colorado. And the polling for the marijuana initiative went up once they started to air those. It's a difference between, and you know this, what the people want, healthcare. It's the establishment that's afraid of the power of the insurance company. And a lot of physicians now are working for hospitals. They're afraid of what the hospital will say, and the nurses. So they have to be careful when they express support. But nobody knows, the hospital won't see how they vote.
I was just wondering what kind of support you have from organized labor and how much labor is helping to get out the people to vote and to campaign.
We've been a little disappointed in that nationally labor is real supportive, and Mark Dudzik is real supportive. What's happened is most of labor stayed neutral. With the Taft-Hartley healthcare plans, they'd have to, kind of, and I don't know if you know what the Taft-Hartley is, but it's like for construction, for an electrician's unit, the union has the healthcare plan, and every employer contributes to it, and so it's a real powerful tool for the union because they own the healthcare, and in order to get the healthcare, you have to be in the union. They're afraid of losing that power, even though they pay less. It's sort of a bind because we're friends. Our leaders are friends with all the unions, and they're backing off of supporting us. And I think that anyone, and even foundations, foundations and some advocacy groups have all tried to get a balanced board, which means they get insurance companies on their board. And that keeps the traditional establishment from supporting us, and that's exactly the same thing Bernie ran into. Hardly any establishment support, and it all had to come from him stirring up the grassroots. But I told you the poll numbers, the people are with us. It's the people who are in the establishment and are afraid of losing something with the insurance companies, and especially if we lose. They'll tell us, well, if you lose, we might get punished for supporting you.
Here locally, we have had a success with a $15 an hour initiative, and we don't have an income tax. But we were able to get union support for a $15 an hour minimum wage increase. I just don't see it getting off the ground in Washington State unless you had a source of income. Like you guys just got an income tax, right?
We've had an income tax for a long time, but this constitutional amendment would be a new kind of income tax. We're doing the $15 an hour in Colorado, and we're trying to build bridges around that. The reality is, if you look at what's going on with the DNC and how they're trying to find some compromise with Bernie, they're much more willing to compromise on every progressive issue and move towards him than single payer. This is, I see, is the crux of the change that we need in the country. And And it's not that the people don't want it, but it's symbolic of the clash between what people want and what the establishment has. There is so much money in healthcare. Our hospitals, we just got a report that Health One, which is the big for-profit chain, makes 33% profit on every dollar it collects. I mean, that's just obscene. 33 cents out of every dollar they collect. And then we have this thing in Colorado where they get phony emergency rooms. They're emergency rooms that charge emergency room rates. They get subsidies from the state. They're freestanding, not associated with hospitals. And so somebody who goes to a phony emergency room gets the pumped up rate for an emergency room. If they have a real emergency, they put them in an ambulance and send them to a real emergency room, and they get double charged. And they're just, I mean, the profit that's flowing in our system to big corporations, for-profit hospitals, is just phenomenal. And that's what we have to take on. But the people are fed up. The businesses and patients can't pay for it. And as our Physicians for ColoradoCare says, the people have lost their morale. This is what's going to make physicians love their work again.
Are you on the ballot at this point in time, or do you need more signatures?
There's this wonderful thing in Colorado that in order to get on the ballot, you have to get your signatures by I think it's like late August. Well, we missed it by a month. We turned it a month late. That meant we got on the ballot for the next ballot, and we had a whole year to prepare. So we got on the ballot a year early, and we've had this time to build our organization and infrastructure. And also because we got in a year early, we're number one on the ballot.
You will be on this November ballot.
Yes, yeah, it's all set.
I have a question about, you talk about the people who are on your side when you get the word out. How are you getting the word out? Do you have a communication strategy, a team, a playbook? How are you getting the communication going out now?
Yeah, as I said, we have a professional digital consultant. That's a 65,000 person mailing list, email list, Facebooks. We had one Facebook post that went viral to 1.5 million people. Where we do some with Twitter, and so on the media out, and we're collecting lists now so that we can reach out to them. We have a speakers team that's going all over the state and speaking everywhere where people will hear us. The idea of the speakers team is to get to thought leaders. In Colorado, the entire marijuana campaign was done by speaking to thought leaders, Rotary clubs, places like that, to establish its legitimacy. On our website, there's in the About ColoradoCare, you can download we call it the green booklet. It's ColoradoCare, How It Will Work. I'll say good things about it because I'm the primary editor. It was people had a lot of questions, and they came up and said, you should explain two more things, and nobody had the same two things. So it's about a 40-something page booklet that you can skim, and you can just stop on the pages you want to land on, and that explains what we're doing and shows how physical demonstration of how well thought out this plan is. So the Speakers Bureau is showing that it's legitimate. We're debating and we're getting good media coverage. We have a good communications consultant, and gradually, it's complicated to tell people how you're going to replace the insurance industry. So we've had a big education job, and then we have the Colorado's. We have regional captains and groups located all over Colorado, and we're starting to hire the regional organizers for a door-to-door campaign. And that's what we'd be using most of our money for right now, is to start to ramp that up. That the most persuasive way to get to people is to talk to them and to get to the door and show to show how great ColoradoCare is, and to show that when you do the math, the premium tax is a bargain compared to what the insurance industry is taking from Colorado. The insurance industry is doing such a good job of being critical; it's helping us.
Yeah, you mentioned doing the math. Is the math in the green book that you can download?
There's a calculator on the website. It's how you can compare your current insurance costs to ColoradoCare.
We have a tentative strategic plan which does include, after the possibility of getting a waiver and going with a plan here in State of Washington, we would then move to join with Oregon and California and Hawaii. We have this grand vision of a Western Union, but we perceive immediately considerable difficulties because, as Merle just said a little while ago, we don't have an income tax, a very regressive tax system, whereas Oregon does have a relatively progressive system with income tax. We don't see immediately how it's going to be so easy to have common ground rules and an integrated system. So when you talk to your folks in California, are you talking about the nitty-gritty of how someday you might get together and have a common plan? How do you think about that?
We don't cross the bridge until we come to the river. Is that we haven't thought that far ahead. I think there might be some advantage to having each state run its own system, have it sort of like Medicaid does. If the federal government set a floor for the states and have each state run it, that it might be better to have local control. That's one of the things that advantages we see ColoradoCare having. That with 21 elected trustees, these are people in the community that people have access to. It's much different than in California. It's so big, it's like a nation. People who are in Sacramento aren't that accessible, and people definitely in Washington don't listen to the little people in their states. Washington D.C., not Washington State. And then the other thing is economically. If you see, we tell providers that we can't underpay providers because they've got feet and they could go somewhere else. So ColoradoCare is going to have to find another way to save its money than the typical insurance company. We had a cooperative insurance company in Colorado, but dirty politics in Washington killed it, and their board supports us. And what they said to us when we talked to their board, they said, what's great about ColoradoCare is that as a cooperative insurance company on the exchange, there were only two ways we could save money. We could pay providers less or give less care. ColoradoCare can cut overhead. So once you get a unified system and you can cut overhead, you want to make sure that it doesn't take money out of providers. And if each state were competing to attract providers, then the cuts would come somewhere else. I mentioned, though, that the hospital, it makes a 33% profit. Well, the hospital doesn't have feet, and ColoradoCare can pay every hospital equally, and that'll give the nonprofits an edge. I understand that hospitals with a 5% profit have plenty of money or 5% extra have plenty of money to invest in the future. So it could cut hospital expenses there without cutting provider expenses. So I'm not saying that state by state plan is best. I'm saying it's something to think about. That's all.
What if non-residents come into your state, then they're sick? What's your plan about that? They're not paying taxes yet.
Paying taxes doesn't get you ColoradoCare. Being a resident gets you ColoradoCare. If a skier comes and breaks his leg, he better have insurance, or he's going to have to pay for it. We cover residents. We don't cover visitors.
How has your local news coverage been? In TV, radio, major newspapers in Colorado?
We've been very effective at getting our word out through the local news. The opposition, gets their news out, but when you put our stuff up against theirs, we have more substance. They have fear. They say things. Well, first of all, they make up a bunch of lies. But gradually, over time, the media is sifting out the lies. So we've been good at that. It's a sustained campaign. We put a lot of resources into it, and so we get good coverage. We have a great team of letters to the editor. We have people all over the state writing letters to the editor, and so any biased article comes out, we can flood the newspaper with corrections.
How about editorials?
We get them both ways, and the ones against us, they don't have the substance that the ones for us have.
Do you have any restrictions in Colorado on last-minute advertising blitzes before elections?
No.
No? Okay. That did in our last attempt at an income tax here.
Yeah, I see the income tax as a huge issue. It's going to take a lot of creativity to get around that. And in Colorado, we can't do anything with taxes because we have a taxpayer bill of rights unless it's a constitutional amendment. But because this will be a more recent constitutional amendment, we can once it's passed, it can trump the previous one, the Taxpayers Bill of Rights. ColoradoCare, one of the things that does cause a problem for single payer countries all over the world is they get a fixed tax system and then they run out of money. And that's when waiting lists and stuff appear. ColoradoCare can raise the premium tax. It takes a vote of members. But if it needs extra money, if it turns out that 10% isn't enough, the rest of the country is going to be paying 16, 17%. ColoradoCare votes and say 10.5%. Will you approve it? And I think that voters, when it's their health care, will approve it.
I'm kind of wondering about advertising for your campaign. Are you using negative campaigning against the hospitals, or are you using just positive statements? I'm trying to understand how your message is worded.
In war and politics, it's not good to attack hospitals, so that's not the main attack we have. We're going after the insurance industry. For negative advertising, I think the truth is negative enough. We're not publicly going after the hospitals. That it's low key that we mentioned that, but I think it's an example of the huge profits that are in the in medicine. DaVita, the dialysis company, donated against us. And a couple of the big hospital chains, the hospitals, own the healthcare system now, and they have a huge amount of power, and they don't want anything that can threaten their power.
The polarization of physicians being pulled into the hospital systems, and then those hospitals and their attenuated physician base are being purchased by insurance companies. So I'm kind of wondering how you're dealing with that, or how you're addressing that issue.
How we're addressing the hospitals buying up practices?
Yeah, buying up practices, therefore finding physicians into their systems, and then all being purchased.
That ColoradoCare sets up, we call it, and it's in that physician's paper, guardrails and incentives to correct the system. It doesn't directly. It's a 12-page amendment. It doesn't. So we tried to keep it simple so that people could read it. It doesn't directly attack the problem of turning providers into commodities that corporations use to provide health care. What it does, though, is eventually with a unified medical record system, and it's set up so that we can do the same kind of smart card that France does, which is a simplified medical record system that allows every provider to communicate medical records. There's no proprietary system blocking communication. That could overcome one of the barriers to independent practice, which is the expense of an electronic medical record system. The other thing is if every patient is reimbursed, that I think that many providers could get back into independent practice. That by leveling the playing field, you wouldn't have to have the power of a hospital to keep up with all the challenges and the bureaucracy. So we feel that it will make the practice of medicine, the business of medicine, more friendly to small practices, but not directly.
I'm one of the surviving authors of the Washington Health Security Trust bill that is still floating around in our legislature and not going much of anywhere. But one thing that we were careful to put in our bill that I haven't heard about for Colorado is some money to help with the workers who are displaced from insurance administration. Do you have any provision like that in ColoradoCare?
Yeah, of course we talked about that because everybody's concerned about that. In our discussions, one of the realities there is that if there's money for people who are displaced, hospitals are going to lay off whoever they want to lay off and say, oh, it's because of this new bill. They have to get this money. It becomes a loophole for corporate for people to claim that these funds have to be available. The opposition has estimated that there might be 20,000 people who lose their job. I'm not sure it's that high. Jerry Friedman figured that most of the insurance jobs are out of state. A lot of the money that goes to insurance is profit, that they get about 5% profit. That's out of state money. So a lot of the money we're cutting out isn't in Colorado, it's out of state, and some of it's out of country. That I hear with several of the insurance companies that you can land in just about any country in the world when you call customer service. There are 500,000 people who change jobs every year in Colorado, and so this will add maybe 10,000 to that 500,000. That it's pretty common. We have unemployment insurance. If they lose their job, they're going to have health care. And the other thing is overall, because we're keeping money in the state and not sending it out of state, we expect a net gain of 32,000 jobs. So while 10,000 people may lose their jobs as administrators in Colorado, there's going to be 42,000. Remember, it's a net gain, so it replaces the 10 and adds 42,000 new jobs that are more desirable than the insurance industry.
Do you have a 501c3 arm of some sort so that tax deductible donations can be made? Or because it's an initiative process, is it all non-tax deductible?
Yes and no. First, the yes part. It's the Colorado Foundation for Universal Healthcare is a 501c3. Website is CO for Colorado, universalhealth.org. And it is the nonprofit that did the research that designed ColoradoCare, and it can donate up to 20% of its money to the campaign. And I'm also the executive director of that, and that there's a lot of ways that helps the campaign. So if you want to give nonprofit money, give it there. The campaign is political. We have very strict campaign finance rules. We cannot accept anything over $20 without saying who it comes from. And the thing is, if we get $5 from 5 people, that's over $20. So we have to report who gave it and their profession, to the Secretary of State, and we have to do that every 2 weeks. So if the donations on the website ask for profession and employer. And that money is easier to use for the campaign, but I guarantee you anything that goes to the foundation will somehow help the campaign while complying with the federal laws.
Does your plan do anything with global budgets for hospitals or any sort of global budgets?
No, I didn't. We didn't think that would fly very well in Colorado, and I think there's enough. You see, for cost and containment, one of I don't know. If you. Of course, you've dealt with all the federal attempts to contain costs in the PQRS and things like this and the pay for performance. You get into that you get some kind of plan for cost containment, and then they decide, oh, this worked in this small experimental group. Let's apply it to everyone. And you come up with these plans that are more problems than they're beneficial. ColoradoCare is a business. It's not, things don't have to get an act of Congress. It's a cooperative business. They can say, well, let's try, paying lump sums for knees this in a project here and see how well it works to contain costs. Does it drive costs down if we bundle payments? And if it doesn't, then they can stop it. They don't need an act of Congress to stop it. We can be much more nimble about trying different ways to contain costs. With a global budget for a hospital, we have 31 hospitals on the Front Range. I don't quite know how we would work that, which hospital is responsible for which people, and people don't want to be told they have to go to one hospital. Now in the long run, while I say we have 31 hospitals, they're at 65% occupancy, and every hospital is building a new hospital. So we're going the wrong direction. But there's other payment structures. If every hospital gets the same amount for the same service, unless they're rural and needs a supplement, or educational and needs a supplemental, then hospitals will stop trying to build a new hospital when they're only 65% filled, and we'll start to cut down on the beds and we'll contain costs there. The biggest thing in containing costs is we get such a leg up on the rest of the country by getting rid of the administrators that we can be a little more thoughtful about the next steps.
Now, do you have any politicians lining up with you, post facto here? It sounds like you didn't want to necessarily go through your legislature. And then, what kind of transparency, like in the Vermont governor's case, he started listening to the insurance companies to say that, hey, it's too costly. Do you have any of that phenomenon kind of going on where it's being recycled, or is that happening? And I know in our city here, we are talking about an income tax, and we think it would be unchallengeable. Because of the state level, they have an income tax provision, but we believe at the municipal level it perhaps won't be challengeable in court. And I don't know, those three things. I don't know, what kind of political support have you had, and then when you think of municipal, I mean, did you think of a municipal approach to healthcare in any sense?
Okay, so first with political support. Yeah, as soon as a politician, we have term limits. As soon as they're term limited and don't have to run again, we ask them to support us. And that's where our supporters primarily come from. Senator Aguilar is the main one that's actually sitting now. Now, we do have, some really good supporters, but when they're in a campaign, they've been told to not push that hard for us. To some extent, that's okay, because if we got political support, they'd all be Democrats, and we don't want it to be a partisan issue. We are a little disappointed that some of the national politicians are as timid as they are about supporting this. So, but the term, as soon as a politician doesn't have something to lose and wants to do the right thing, those are the ones that support us. And our two main leaders are Senator Aguilar and Senator Nicholson. Senator Nicholson got voted out of office over a gun issue, that we did some gun control, and the gun nuts went wild. And she's a nurse. So they're recruiting a lot of other former politicians. So the second thing is about Vermont. I'm so appreciative of Vermont. I had a number of discussions with their policy people, Robert Lunge and Michael Costa, who were the governor's policy people, about what's going on up there. And they solved so many problems that we were having, because they had $1 million to put into really researching things. And they figured a lot of things out. One of the things I learned from them is the way they put it together in Vermont is, after everybody, legislature and the people and the governor said we want single payer, they went, they set up Green Mountain Care, and to show how open-minded they were, they brought somebody from the insurance industry in to design Green Mountain Care. And they said, design a system and don't worry about cost. Do whatever you want. Now they had a lot of barriers, like 40% of their people get treated in Connecticut. There's, boundaries. People work in one state and live in the other. There's lots of problems. But Green Mountain Care set up a system that was more administratively complex than the insurance industry. So they didn't have savings. Then the governor went around and said, gee, I don't want to do this with anybody that's an enemy. And he talked to big business and said, oh, well, you guys don't want to be in because we're just a little state. That's okay. I mean, they're only 600,000 people. And then they talked to low income people and said, oh, you shouldn't have to pay anything, even if you get a $10,000 insurance policy. And then they talked to rich people and said, oh, you shouldn't have to pay so much because you're rich, self-employed. Seniors didn't have to pay anything, even though they would get a lot of wraparound benefits. The political process is what killed it, because and then they turned to Michael Costa and Robin Lunge, the policy people, and said, figure out how to finance it. Well, it can't be financed then. So some of that was secretive, but a lot of it was out in the open. That once you start, Medicare would have never gotten through if they went around to everybody and said, should you pay, this much Medicare tax? Everybody would say, well, in fact, every group we've gone to that, to talk about, when it was sort of a possibility, we said, what do you think of it? And they said, well, it's really good, except, this tax on us, we have it's really kind of unfair, because we have a special situation where we shouldn't be taxed like everybody else. So I think there are some dangers, and it's not just the insurance industry. Everybody, once you get in that process, wants something. This will be protected by the Constitution. It'll be set up. The trustees will have the power, and it'll be transparent. They can't do it in secrecy. You see, Colorado is an island, a population island, and we don't have any major population centers on our border, which is one of the reasons we can do it so well. If the cities, though, are not islands. Now, interestingly, Grand Junction on the western slope has a smaller population island, and I don't know how many of you read PR's book about about the system there, but and it's terribly Republican conservative. They set up a single payer system for their population, where the physicians got paid the same amount whether they saw an uninsured, Medicaid, Medicare, or no, you can't include Medicare, but uninsured Medicaid or insured patient, and they pooled all the money, and they made it work for a number of years because they cared about community. They didn't see it as a political issue. So, if a city were a population island, they could do that. But most of our cities on the Front Range all blur together.
Well, they have in San Francisco, Healthy San Francisco, which was sort of surpassed by Obamacare, but they still treat all their undocumented or any visitors really to the town, it sounds like.
Let me just say about San Francisco, you see, if you add care for the undocumented, you're adding an expense. If you add, like, some people say, well, why don't you just add care for basic care and then people get insurance for their secondary care? Well, then you're adding one more insurance system to a crazy system that's got just all kinds of rules, people fighting over who should pay. The reason ColoradoCare saves money is it can eliminate the insurance industry. It takes away all these hundreds of programs and complexity and has just one. And it focuses, then the money goes to healthcare, not to administrators. And we can pay for more doctors and nurses and fewer bureaucrats.
Now with Vermont, the difficulty was the ERISA waivers that Obama, I think, perhaps maybe you correct me on this, Obama said that he would work on getting ameliorated, I guess. But have you heard any kind of assistance that you need for these waivers, or?
Yeah, we talked with them. The waivers they were surprised. People people, a lot of people estimated the waivers would be higher than they're going to be, and part of the reason is because the waivers didn't have clear rules, so nobody knew exactly what they meant. I don't know how much of it's the Obama administration or whatever. We based our waiver incomes and our economic analysis on what Vermont found out they could actually get. And so in that way, they blazed the trail for us. And that's another way they helped us out, because otherwise we would have overestimated the waivers. Only $700 million of our operating budget comes from waivers. And I know it sounds silly to only say only 700 million, but since I'm the economist doing this, you win $1 billion here, you lose $1 billion there. We could absorb, even if they cut out the waiver money, the 700 million, ColoradoCare could absorb that easily with its flexibility.
I'd like to just make one more comment about ERISA. Having looked into this a lot when we were writing the Washington Health Security Trust, and we would get around it in our state because we would be requiring all employers to pay a payroll tax for the public good. That payroll tax would then be used to provide health coverage for everybody. But the employers would be perfectly free to go ahead and buy duplicative insurance for their employees if they wanted to. But I don't think very many employers are going to pay a tax for one set of health benefits and then also buy private insurance for their employees. So your comment about taking away the market for the health insurance industry is right on. And ERISA only says that the state can't do something that puts burdens or puts requirements on businesses with regard to their employee benefits. And you're not doing that. You're simply saying, well, you're going to pay into the tax for everybody.
You've given a perfect explanation of how to deal with ERISA. Interestingly, I started my work working with the National Coalition for Mental Health Professionals and Consumers out of New York, and did a lot of work in Washington, and went to did a lot of work with attorneys trying to do lawsuits against ERISA and collusion among the insurance companies, and went to the Department of Justice. I worked with 5 different law firms that were Wall Street and Washington based around ERISA law. And you gave the bottom line that everybody who looks into ERISA, including Vermont and their attorney, Robin Lunge, and their consultant, that is how you do it. The only thing I have to add to that is the less you say ERISA, the better off you are, because if the campaign says we've licked the ERISA problem, then it looks like you're trying to manipulate ERISA.
That's true, although we assume that in Washington State, the major employers would immediately turn around and sue in federal court, claiming that the Washington Health Security Trust damages them under ERISA. The question is whether they would win in federal court, and of course that's always a coin toss. Although I did ask a Ninth Circuit appellate judge, I curbstoned her at a conference, and told her the story and asked if she thought it would work, and she said yes. But that's very unofficial, and she's dead now anyway. This was 15 years ago.
We've had so many attorneys look at our through the legislative council. There's at least 8, maybe 12 attorneys who have examined it, and these are the experts in state law, federal law, where they clash. Can we do it? I guess I'm tempted to say, you mean a lawyer is going to object and want to sue in court? This is a news story. We must tell everyone that a lawyer might want to file a lawsuit. That's what they do. They're going to file all kinds of lawsuits and try and poke holes in this. That's the way the game's played. Thank you so much for having me, and if there's anything,
Thank you for joining us. It's been a pleasure.
Yeah, and any support you can give to reach out to your email list to see if they would like to join with us. We really do need a national base. So thanks again. Hope to see you again.
Yes.
Okay.
Thanks.